COVID-19 hospitalizations and test positivity rates continue to drop across the country. Many provinces have started easing COVID-19 measures. Today, in fact, Ontario is dropping most of its pandemic rules. Proof of vaccination will no longer be required at most restaurants and gyms and movie theaters. Capacity limits for sports and concert venues dropped. So teams like the Senators, Maple Leafs, Raptors, they can play in front of full arenas again. And settings where capacity was limited based on social distancing, including, retail shops, grocery stores, that requirement is now lifted. I can tell you there are mixed feelings about the end of COVID-19 measures in Ontario. Some feel it's just too soon to drop restrictions. CBC's Katie Nicholson is on the story live from Toronto. And Katie, you've been speaking with people worried about the changes. What are they saying?
And, lots of people are worried about it being too early to drop the vaccine passport. But specifically, I wanted to know how people who are at higher risk, who are immunocompromised, feel. So nationally, that's about 14% of the population who are 15 and up. And of course, this is a segment of the population that if they develop COVID, they're more at risk to have complications. So I talked to Sherry Payne. Now, she has 4 shots on board of the vaccine. That's boosters and the vaccine. She has Crohn's disease, and even that's not really enough, she fears, to keep her safe. She's worried that this passport being lifted is way too early. She used to love to go to concerts and hockey games, and she says she's really filled with anxiety when she sees hockey games in the States where the arenas are full. And it really means to her that she is at greater risk if she goes out into the public going forward. Here's Sherry Payne.
People like myself that are autoimmune diseases and on medications that suppress our immune system, we're going to have to continue to protect ourselves and to really just still mask up. I still won't be going out to restaurants and or concerts or hockey games. I'll be carrying on like I have for the last 2 years.
And so I also spoke with a woman named Kate Busia. Now, she has an acquired brain injury. She lives in a congregate living facility. She's also at higher risk. But kind of on the other side of things, for her, this move forward is opening the world up a little bit. The programs that really made up the bulk of her social life are starting to open up again. And so she's actually really looking forward to that. Now, she is telling me she is going to be cautious going forward. She's still going to mask. The mask mandate's still in place, although Premier Ford has hinted that possibly we'll get some updates on that. Maybe we could see it go away by the end of March break even. So a lot of people who are immunocompromised telling me that even beyond that, they're going to continue to mask up just to make sure they have that extra layer of protection. But we have to remember that for a lot of people who've been really sequestered during this, there is some excitement, too, about finally being able to do things.
And what are doctors, Katie, and other medical experts saying?
Doctors understand that we have been living with this for 2 years. I talked to Dr. Janine Mccready. She's an infectious disease doctor at Michael Garron Hospital. And she says, you really don't know how much COVID is circulating right now in the community. We're not doing the same robust testing we used to do. There are some snapshots through wastewater testing, but we really don't know. And so she says that's one of the reasons we just have to take extra care when we're thinking about the most vulnerable in our population, even as the rest of us really try to push forward to that sense of normalcy again. Here is Dr. Mccready.
Really, the onus is on all of us to kind of help and protect all the people around us, to think about the child that has a stem cell transplant that you want to be able to continue going to school, or the mom that has Crohn's disease that, wants to be able to pick her kids up from school and still send her kids to school.
So Mccready says this essentially means when we're dealing with people who are high risk, try to keep your numbers small in those groups, try to meet outside and wear a well-fitting mask. And she has specific advice for people who are high risk. It's essentially, if you are developing symptoms of COVID, try and get yourself a PCR test because there are new therapeutics out there and early intervention is key for that segment of the population. So Hannah?
Thanks for that, Katie. CBC's Katie Nicholson in Toronto.